Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life,
A&E selfie!
Down below. Too slow.
love,
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Are you ready to face the day?
Yeah, number 3, please. Thank you.
Monday's our worst day. The bus loads are going to arrive.
Emergency nurse practitioner Craig has worked at St George's for 10 years.
I'm from Western Australia. I grew up in a gold mining town, Kalgoorlie, which is like 800 kilometres northeast of Perth. I remember my first day in London. I got off the tube at Piccadilly Circus and just stood with my mouth open like, oh my God. It was quite overwhelming.
Where are we going, to the canteen? Or...
Oh, I wish. Breakfast would be good. But I haven't looked back, and much to my mother's disgust, I think I'm partly British. To remove a nail is quite brutal.
Nice.
As a nurse practitioner, I do literally everything that the emergency care doctors would do. So just tell me if you get any discomfort whatsoever. 1 minute you're dealing with someone with a skin rash, then you stitching somebody's head up.
That looks horrible. If it was an interrogation, I would have spoken by now. So.
And that's what I like about it. It's fast, doesn't stop, and I love meeting people. You know, that's the key, I think.
Hello, St George's. Yeah, is it medical or trauma? Yeah. Do you have a pulse? Okay. Adult medical priority, 8 minutes.
The 54-year-old legal secretary is being rushed to St George's.
3 LOCs with a low blood pressure. They couldn't give me a pulse or a GCS breakdown.
She collapsed in the street on her way to work.
On the day Mary collapsed, it was actually my birthday. If it was your birthday, Mary would always want to make a fuss of you. I expected to come into work and there to be lots of balloons and banners. I then got a call to say that Mary had been taken ill on the way to work. I actually thought, no, Mary, if she doesn't have breakfast in the morning, sometimes her sugar levels can drop. I felt actually quite a bit guilty that, oh my God, it's my fault that Mary fainted because she didn't have time for breakfast because she was desperately trying to get into the office.
Information from paramedics show that her heart rate was so slow, it almost stopped.
Sit the back of this up a little bit. Is that okay? For now.
Right, Marie's 54 years old. She's had 3 temporary loss of consciousness. She had one this morning at 7:15, another one at 8:15 in the street. She fell and banged her head. Her pulse went down to 20. Her eyes went completely hypoxic. She started shaking for about 10 seconds, and she had a prominent left-sided droop on her face.
Registrar Mevan will carry out tests to find out why Mary collapsed so suddenly.
When a patient comes with a collapse, we need to establish whether it's a simple fainting or something sinister.
If you can sit up for me. Sit forward.
The main worry is whether this is actually the cardiac problem.
What were you doing?
I felt hot and I took off my cardigan, put it in my bag, and I was just getting some water.
Yeah.
And apparently I just went down.
Is that when you got this bump? Okay.
Yeah, so that was about 47.
Right.
Yeah.
Any other medical problem, Mary?
No.
No, nothing.
No, so
You don't
just
take any regular medication?
No.
Are you a smoker?
No.
The ambulance picked up your heart rate was going very slow. It should be around sort of 70, but they picked up your heart rate 20. So very slow, yeah. The heart beats every second of every day. It should beat around 60 to 80 beats per minute. So 20 is very low.
So we'll do a chest X-ray and we'll take it from there, yeah?
Mary and I have known each other as sort of work colleagues and friends for about 19 years. We just clicked instantly. We just had an instant sort of rapport. We just kind of bounced off each other, and you know, I knew fairly soon that we would be sort of lifelong friends.
Now, do you still feel sick, or are you okay? Oh, whose birthday is it?
Yes, my friend Lindy at work.
Oh, Lindy's not going to get her balloon, is she?
Not going to get her balloon today.
Careful it doesn't float away in the back of it.
She'd already arranged a lunch for that day for myself and her and a group of girls we call the Barcelona Babes. And the reason they're called the Barcelona Babes is because we all went to Barcelona for a weekend.
So I'm here and they're doing some tests and things. I'm going to let you go, Linda, because the doctor's here, yeah? Yeah, yes, yeah. I'll talk to you later. Yeah, bye, Linda, bye.
She likes to be busy. She just tries to divide herself up into so many pieces to try to help everyone and keep everybody happy. I often would say to Mary, stop running around trying to do so much. But that's just not the kind of person Mary is.
Doctors take X-rays to see what could be causing Mary's drop in heart rate.
I didn't actually realise how serious it was. I thought she would just have a few tests in the hospital and be sent home. When I found out what had actually happened, I was completely shocked. Because, you know, without her in our lives, it would be very different.
We're just going to get you around for a CT scan.
Yeah, thank you.
54-year-old legal secretary Mary arrived in A&E after collapsing on her way to work. Paramedics at the scene recorded that her heartbeat was dangerously low.
Breathe in and hold your breath.
Doctors have sent her for emergency CT scans.
Mary grew up on a small farm in County Cavan, in Ireland, surrounded by greenery and rolling countryside. It's about 2 miles from the nearest village. She used to either walk or cycle down to the local shop. It really was in the middle of nowhere. Mary's from quite a big family. There's 6 of them in total. She's got 2 sisters and 3 brothers. Her mother was always a very keen baker. So being such a big family, I think it was always important to get to the table first when there was like apple tarts and cakes being baked, otherwise you might end up with nothing. When you live in the countryside, it's quite quiet. When you hear about the bright lights of London, you have aspirations to go and explore. And she packed a bag and she got on a flight and she came to London. Even though she's a long way from home, her mind is always on home. You know, she's always constantly thinking about it. Her mother is 90 now and sort of needs to be looked after quite a lot. But she can't be there all the time, and she does rely on her sisters to help out. She tries not to talk about it, I think, because sometimes if you talk about these things, then you get upset by them. But I know how much she does worry about her mother.
Mary will remain in resus while doctors assess her scans to find out what caused the sudden drop in her heart rate.
She's got a pair the same as mine, look, but shorter.
I might say, more muscles.
I can see a rainbow.
See a rainbow. Sing along with me. Mr. Wood?
See what I started.
It's dangerous.
Jessica Young.
I'll make it all right.
All right, see you in a bit.
How are you?
27-year-old Jessica has come to St George's with an open wound that won't heal.
Have a seat for me, Jessica. My name's Craig. I'm going to look after you. I'm one of the nurse practitioners. So, what's happened?
I had a lumpectomy on the 29th of May.
Okay.
Half my wound's closed up nicely, but the other half is open.
Okay. So, you noticed a lump a while ago?
End of March now.
Okay. And you know the results of the...
Stage 2.
Okay.
2 months ago, Jessica was diagnosed with breast cancer.
I've got to go back in a couple of weeks for another operation to remove some more tissue.
Okay.
And then go from there.
And how are you feeling about that?
I don't want it done, but I've got to.
It's a bit scary, isn't it?
Yeah, it is really scary.
But it's important to have that done.
Yeah, yeah.
It's not a nice process for you to go through. You know, the most important thing is to listen to what someone's saying to you, and that takes a bit of time. How old's your daughter?
She's 7.
Okay, and she knows everything?
She knows that Mummy's not well, and she knows that I had an operation.
Yeah. Most patients are pretty scared about what's happening to them. Lay down, make yourself comfortable.
I have no veins, so my hands are the best ones.
You're nice and young, you should have nice veins. We'll see. Let's do this wound swab first. Is it quite sore?
Yeah, it's really painful.
But most of all, you want to make them feel safe. So that's the nice part about it.
So why is one half of the wound closed and the other half hasn't?
Sometimes that happens.
Okay. Will it eventually close up? Or?
Yeah, it will.
Yeah.
Don't know why, it just does happen.
Okay.
If you show that you are genuinely interested in that patient, it makes a massive difference. And it may be the difference that helps them survive and helps them get over their condition.
Hello there, hi. Could you get 2 portable chest X-ray to resus, please?
Mevin has been a registrar at St George's A&E for a year.
Yeah, all right. Thank you, man. Thank you. Bye. I moved from Sri Lanka about 10 years ago. Education in UK, all around the world, it is well recognized, so I thought this is the place I had to be. The lifestyle back in home is, they're pretty laid back, relaxed. But it is absolutely fast-paced in London. The way people walk, they are living in a fast lane, actually, yeah. I think we need to slow down a bit before it's too late.
Okay. Yeah. You said by land, yeah? Okay. Adult male, trauma call, 8 minutes.
A 37-year-old IT project manager is being rushed to St George's.
Hems by land, motorcyclist versus car, opposite stable, GCS 14.
He was travelling to work on his motorbike when he collided with a car. The man's injuries are so severe that emergency doctors and paramedics were called to the scene. His colleague Jonathan was at work when he received a call about the accident.
Everyone knew who Rob was. He was a well-known person in the company. Rob would usually be at the office before 9, but that day he wasn't there. So at 9, we started wondering what has happened.
Guys, we are getting the trauma.
His wife had called to the office. She said that Rob's neighbors have seen a motorbike like his on an accident.
On slide, ready, steady, slide.
It was shocking for all of us. People were just coming downstairs asking what happened to Rob.
This is Rob. He was motorcyclist versus car. He T-boned into the side of the car, turning right onto him. He's got possible closed head injury and he's got a complex mandible fracture. He's got a left tibial fracture.
He's got 2 missing teeth at the top.
All right, guys. If you can get the scoop off, please. Yeah.
Keep your head nice and still for us. Keep your head nice and still.
What's it, Ron?
My name's Johnny, I'm one of the bone doctors. We're just going to do a quick examination, OK? Don't shake your head, don't nod, just say yes or no. Can you tell me your name? What was your name? Robert. Robert. Can you tell me what year we're in, Robert? What year are we in now? What year is it?
Right, we'll send him across for CT, yeah?
Doctors take Robert for an urgent CT scan to assess the severity of the injuries to his face and head.
As we were doing the primary survey, we found Robert was confused, and that made me worried about whether he got associated head injuries.
So CT is ready for him.
I remember that the most worrying thing was that someone mentioned a brain injury. For the rest of the day, none of us could concentrate. I remember just wanting to hear some more news.
Like the top of your forehead has gone a bit normal colour now, but your face is still red.
Oh, it's throbbing now.
Yeah. What you've done is you've taken a slice off. I can see that.
I was going to save it and bring it with me.
Legal secretary Mary has been in A&E for 30 minutes after collapsing on her way to work. Whilst doctors await Mary's CT scans, the results from her chest x-rays have come back clear.
I'm going to speak to cardiology.
Yeah.
We need to rule out a possibility of what we call cardiac syncope, which is irregular heartbeat.
Okay, yeah, thank you.
Mary would have loved to have children, but unfortunately, the opportunity never presented itself. Whether that was because she spent so much time in the office or she never met the right person.
Oh, hi, Alicia. Just me here. Say hi.
Mary is a workaholic. She's never without her phone by her side.
It's probably best that I cancel both tomorrow and most likely Thursday.
Often we're asked at short notice if we can stay late, so you were coming at 9:30 in the morning and you may not go home till 5 o'clock the following day, but Mary was always happy to do that.
I have an out of office on my voicemail, yeah? But I haven't got an out of office on my emails. It'll be fine. I'll make it fine, Anna. I'll make it totally fine. I'll make it totally fine. It'll be fine.
I used to say to her, you know, you need to slow down, Mary, you know, you're going to be absolutely exhausted, but she never did.
Yeah, I've told Mel where my notebook is, so Mel will get the notebook for you and I'll have his number in there.
I think Mary would have been a fantastic mum.
OK, thanks, Michael. Bye.
She's godmother to 3 children. It's a shame, actually, that Mary was never able to have children herself, just because that's the way life turned out.
Oh. Oh, God.
She's gone a bit bratty now. I'm way to lose weight there. A bit dry. You all right there? You all right? Guys, I just have some help. Mervyn, you just come and have a look.
Mary's heart rate has suddenly dropped to 35 beats a minute.
Give it atropine. Atropine.
What, 3 or what? That's 3 milligrams.
3 milligram, yeah.
3 milligrams.
It is very dangerous with a heart rate of around 20 to 30. They can go into a complete heart block, what we call a cardiac arrest. Fine.
Just going to lie you flat just for a moment, just while your heart's going a wee bit slow, OK?
Early today, 54-year-old Mary collapsed with a low heart rate on her way to work.
Can you speak to me at all?
Her heart rate has dramatically dropped for a second time.
So I've given 2 meals, that will be 600 miles.
Doctors need to act quickly to stop her going into cardiac arrest.
Someone's heart rate is slow means their natural electric circuit is not working and they will not able to sustain the blood pressure they need if it is not time critically treated.
Hold up, there's a bit of oxygen just going on your face. Head forward just a little bit. That's it, just relax back, OK? Take some nice deep breaths. Just come up now.
She's just the best friend that you could ever hope for, really. When myself and my husband were going to get married, we invited only family. But I wanted Mary to be there to share that day with me, so she kept the secret with me. It was very important that Mary was at my wedding because she is my closest friend. So when I heard that she had been taken ill on the way to work, I felt a bit guilty that I wasn't there.
Hello, hi. Just now she had some atropine. It dropped to 32 sinus.
Mary's heart rate is now stable. A cardiologist has been called to assess her condition.
Was she complaining of any other physical discomfort as it happened, or did it just happen out of the blue?
It just happened, and she came round quite quickly. It was probably only 4 or 5 seconds.
Mary likes the fast pace of life in London. She is very sociable. She's always like going off to the theatre, going to the cinema, going for drinks. She would never say no to an invite to go out anywhere, and we used to get a group of people together, you know, end up maybe going in some sort of dodgy salsa club down Charing Cross Road even on a Tuesday night, you know, where margaritas are like £5 for a jug.
So what I need to do now is just make sure that I take some pictures of your heart from the front of your chest, okay?
Yeah, it's just frightening.
I know, yeah.
I've never had any issues at all, you know.
Sometimes Mary would sort of go out 3 or 4 or 5 nights in a trot. I used to say to her, I don't know how you do that. But that's just the kind of person she is. She likes to be busy. I think she would find it quite difficult to adapt. She had to stop running around.
Because this is an electrical issue, the solution also has to match that. In the case of the kind of electrical problem that we are dealing with in your case, it's a pacemaker which is a solution for that. Okay. It's like a device, almost of this size, something like a small battery-type device. And what we normally tend to do is, under local anesthesia, we tend to make an incision or a nick under your skin. We tend to send specialized wires, one of which will be put into your lower chamber of the heart, and another one which gets fixed into the upper chamber of the heart.
Oh my God.
Okay? Do you have to let any of your family members know that you're here, or?
I don't really know.
Okay.
My family are all back in Ireland. I don't
Are they? Okay.
I really don't want to
bother them at this stage.
Strain on them.
No, sure.
Her family are always in her thoughts. We often talk about her family, and I know when she's upset. She probably doesn't like to spend too much time on her own. She just likes to be in the company of others. Mary's friends have become like a surrogate family to her.
But I obviously have no range. I have no clothes for staying overnight.
Don't worry about that, because we've got pyjamas and gowns and things that you can wear, and toothbrushes and everything like that, so don't worry.
So I don't want creating any fuss any place. But do you know other people of my age who've had?
Oh, I've seen people my age have a pacemaker put in. It's less common. It's something more common in elderly people, but it's not something that doesn't happen with people your age.
Mary will be taken to a cardiac ward before surgeons carry out emergency surgery to fit her with a pacemaker.
We're just going to start off by scanning your head and your neck first, okay?
It's been 20 minutes since motorcyclist Robert arrived at St George's after a collision with a car on his way to work.
Okay, that injection's starting now, 60 seconds.
He's been rushed to CT for a scan to determine the extent of his injuries.
Breathe in and hold your breath.
Basically, he was my boss. When I first saw him, I thought that he was angry, someone that wasn't that approachable, but it was only the first look. Basically, I require a visa to be in the UK. I went to Rob, then immediately he said, don't worry about that, I'm gonna get everything sorted for you. Through all the stages, he was really, really, really supportive. That was one of those moments that you think, well, this guy, he's a good friend, a good person.
Oh dear.
He's done temporal bone, and he's also got intracranial gas on the right.
Initial scans reveal Robert has a bleed on the brain.
Rob is coming from Poland. He was for his family, and they rely on him for all their life in the UK. He always was mentioning Isabella. She's the mother of his daughters, and he adores his girls. It probably would have been devastating for them.
Yeah, morphine, please, yeah. We'll give 5 to 10, yeah.
Some carboxyl.
Oh, yeah.
He's been the engine for that family. He's been the one who has put all of them where they are today.
Robert's partner Isabella and 3-year-old daughter have now arrived in A&E.
Rob, hi. Your family has come and I'm going to speak to your wife, yeah? Is that all right? Okay.
Probably 2-3 days after his accident, he was going on holidays to Poland. And he has bought everything, he has bought his tickets. He was taking his 2 daughters to Poland. And he was really looking forward to do that.
Hello there. Hi. I'm the doctor looking after Rob. So he got pretty much multiple facial injuries. He broken a few bones in the jaw. He got a small bleed into his brain. You okay? Sorry. Giving bad news is a very difficult task. You have to be very empathetic and put yourself in their shoes when you're talking to the family.
Yeah, have you ever been in that position before?
Myself personally, yes, I have. When my father died when I was very young. When the news came that he died of a heart attack, it was unbearable. He was a fit man and it just happened just like that. But he definitely need to have surgeries around his facial bones. But plastic, they are going to fix him. We are giving him a clean-up and then you can come to see him later. Give us a 5-10 minutes, yeah?
Okay.
My mother had to shoulder the burden of bringing up 5 children, actually. She's done a wonderful job. How is he at the moment? How is he?
Still the same.
She realized that I am a compassionate person, and so she sort of earmarked that you're going to be the doctor from very tender age.
See, you have to continue to do it until you get these. You see them? Them lumps. Yeah. Them, yeah, you have to get them lumps there. Yeah, and the man them say, Zaga. Wagwan. Yeah.
Ring.
It was roughly an hour, and then we might hear something, or it might be longer.
Want to do the crossword? What have you done?
I've got into a fight with a phone box.
With a what?
Phone box?
A phone box?
Yeah.
Rocky.
Okay, so these are some antibiotics for you to take.
27-year-old Jessica had a lumpectomy a month ago, but one of the wounds from the operation won't heal.
It doesn't look too bad, the wound, so that's the good thing. This is the ointment that I want you to put on.
Okay.
Caring is really important. Reassuring them in the best way you possibly can, and if you've been through stuff yourself, that helps. Did you have your tattoo done because of?
Yeah.
When did you have it done?
I had it about 3 or 4 days after I found out. No, it's something, hopefully, that I'll believe in myself. And,
Absolutely.
but it's not doing anything at the moment. I'm not believing in myself.
Oh, you've got to. You have to. You've got to be strong.
I'm trying to, but it's hard.
Yeah. I ended up in intensive care in 2008 and had emergency surgery and ended up with an ileostomy, which is part of the bowel coming out of the abdomen, and a bag. Basically, they didn't think I would survive. I remember saying to my partner, can you open the curtains for the last time so I can see the sun? because it was that serious. It was just petrifying. And have you got plenty of people around you to help you?
Yeah, I've got my mum, my dad.
So they've
got a load of friends, yeah.
Make sure you talk to them.
Yeah, I will.
You know, don't hold it all inside, because, you know, you are going through one of the hardest things that you're going to have to go through. And all that I wanted was somebody to tell me I was going to be okay. From my experience, I had a rectal nurse who, the moment she saw me on the ward, she knew straight away what my problems were. And the thing I found the hardest was, although I am a nurse and I have lots of knowledge, I was no longer a nurse, I was a patient, and I needed reassurance. And she honed in on it and she hit the nail right on the head.
I went through panic attacks.
Yeah.
I had to go on diazepam for the first couple of weeks.
Yeah.
Just to get up to the hospital.
So you've got a lot to face.
Yeah.
But just make sure you do talk to people. Don't sort of shut yourself away, and make sure you talk to your family, because it is really important.
Yeah.
To have an ileostomy has a massive impact on you. And I didn't even want to look at it. And boy, did I have some great dialogue with my colorectal nurse. You know, and I think I put her through a hard time, but, you know, she knew the right way to deal with me, and that's what got me through it. If I didn't have her, you know, it would have been very, very different. You know, you can always come back and see us.
Thanks.
You know.
Thank
Okay.
you.
All right, take it easy.
Thank you.
No problem.
Thank you.
Thanks.
Robert's CT scans are now back. His lower jaw is fractured in 2 places.
Where are both teeth?
His teeth are missing. 2 are gone. Not a happy looking jaw.
Was there any mention that he was wearing helmet? Doesn't look like he had.
Apparently it was a half helmet.
Half helmet without...
There's no face guard on the helmet. So there's no damage to the helmet and there's no face guard on the helmet. So basically he went and hit the side. This is the dent in the roof is his face.
Due to the severity of his injuries, specialist doctors from 2 departments have been briefed.
The broken bones and the fragments from the bones and also the blood can clog up your airway. He can choke his own blood and cause airway compromise. Right. Can lay back.
It's been 1 hour since 37-year-old IT manager Robert arrived in A&E. He was riding his motorbike into work when he collided with a car.
Can I stand up?
No, you can't stand up. You can't stand up.
He was wearing an open-face helmet and has extensive facial fractures and a head injury.
Okay. I think it needs to be fairly quickly done because he keeps swallowing blood and been throwing up 3 times with us.
Dr. Timothy is a specialist in facial injuries.
I'm just going to have a look, okay? Can you feel me touch your forehead on the either side? Yeah? Can you feel me touch your cheek? Can you feel me touch your cheek? Can you feel me touch your jaw?
Because Rob, he adores motorbikes.
Can you feel me touch your lip? Right. So I'm just going to come in behind you, okay? Have a...
He was always like talking about the bikes. When we were asking what are you doing during the weekends, he usually told me that he was going outside to the countryside on his motorbike.
Can you open your mouth? Bite down if you can.
I always express my concerns about motorbikes, but I think that for Rob, the motorbike is like one of his arms. Yeah, it's something that he wouldn't be able to live without.
He's got obviously bleeding in the mouth because of the fracture, and he's lost a few teeth. Okay.
All right, yeah. Let us know whether he's going to the theatre or not, yeah?
Robert's partner, Isabella, is in the relatives' room. Doctors have given her the okay to visit him.
Rob, we'll get you some anti-sickness now.
It's the first time she's seen him since Robert left the house for work.
Czemu się palec nie poszedł w szpitalu, wiesz? Nie powiedzieli.
Would he end up the same person that I met before the accident? And so I don't know what would happen to those two girls and Isabella if he had like serious consequences after the accident.
Does he have any painkillers?
He's had lots of painkillers, yeah. Some morphine and things. So. You feeling sick? We just suction a tiny bit that away.
He's got a fracture of his lower jaw. He's got a few fractures of the other bones of the face. In most cases, the smaller fractures on the face, those normally rarely need any sort of intervention, but certainly the broken jaw is fixed.
Okay.
Specialist Dr. Timothy will now wire Robert's jaw ahead of surgery.
Before his accident, he wants to take his girls out to Poland. He has a plan for them. He bought a piece of land there and he wanted to build a house. And I remember that I was sad because he was going on and about what he was going to do for that house.
Sorry, I keep touching your top tooth, Robert. I'm sorry about that.
You don't want to think about it, but it crosses your mind that he wasn't going to be able to join us again.
Hi.
I think that's how life-changing that could have been. What can you do? Just sit and wait for the best.
Robert will now be taken to intensive care until plastic surgeons attempt to rebuild his jaw and face.
When I had my collapse, it not only shocked me, but it actually shocked all my friends. When I was told that I was to have a pacemaker fitted, my world just fell apart. My friends call me Blammy O'Reilly. It's a fun nickname, and I guess I get the name because I'm a fun-loving person. I love life, I love partying, I love socialising, and I love just having fun. My experience has told me to appreciate life. I've been given a second chance at life. I realised I need to slow down a little now and take life in the slower lane rather than in the faster lane.
I was discovering bit by bit what happened. When I looked properly at the mirror in my bathroom, I was like, oh, bloody hell, it's not great. I just want to take it easy, I want to get better. My priority is my family, and I want to make sure that I'm here for them. There are good and bad days, but I think my girls, that's what really matters to me.
How long have you had this ring for?
4 years.
Yes.
They're going to cut the ring off here.
Doing really well, really well. Paediatric priority call.
He stepped out in front of the car and was subsequently rolled underneath the car, getting caught underneath the front axle.
He wasn't flailing around, he was actually very still.
Your dad, do you want to pop in?
I just felt so helpless.
He rolled onto the car and he's got a significant head injury.
you.